Breast cancer staging provides helpful information on how large the primary tumor is and how far the cancer has spread in the patient's body. Knowing the stage gives an educated estimate of life expectancy and the chance of a cure. Today we'll talk about the staging of breast cancer based on the Manchester classification. In stage 1, the tumor is confined to the breast. Any skin involvement covers an area less than the size of the tumor. Stage 2 is where the tumor is confined to the breast, but palpable. Mobile lymph nodes are present in the axilla. For stage 3, the tumor extends beyond the breast tissue. Stage 3 can further be subclassified into stage 3A. That is, when there is skin invasion or fixation over an area larger in relation to the size of the breast, or when there is skin ulceration. Stage 3B is when there is tumor fixation to the underlaying muscle or fascia. If there are axillary nodes, they are mobile. And lastly, in stage 4, the tumor extends beyond the breast tissue, and there are fixed axillary nodes. There is also supraclavicular nodal involvement, satellite nodules, and distant metastases. Thank you for watching.